Hello everybody, my name is Mona Chiso. So today I'll be making my Unit 3 journal video. So today I'll be talking about a significant patient interaction and the reflection of the psychiatric mental health nurse practitioner role. So I'm going to talk about an interaction I had recently with a patient in an inpatient clinical setting during this clinical rotation. So a 65-year-old I met a 65-year-old lady. So this lady, she was very delusional. She was also hallucinating. She was really, her speech was so pressured. She was so like she wasn't even talking to staff and all that. So each or when you ask a question, she wasn't really that responsive. So she was really aggressive. She was very aggressive. So after a little while, they brought her in my office. I tried to talk to her. She wasn't really talking to me. So what I did was I had a pause and I just left her. I just left her. I wasn't asking her questions. I began to offer her questions. Do you want to eat? Do you want to do you want something to drink or something like that? So she paused a little while. She started talking that people think I'm crazy, but not that I'm crazy. I'm not really crazy. It's just that I have a special kind of behavior. I paused a while. I said, okay, this is the best time to ask questions. So I got her a cup of coffee, and then I started asking her questions. She started responding. So what this means to me is that, as a psych mental health nurse practitioner in future, it's not all about being judgmental. It's not about being firm. It's about being patient with the patients, having that patience, not judging them irrespective of what brought them to the clinic or irrespective of their behavior. So having patience with them will help to create trust. It will really form a foundation for for me to get information from them. Just allow them to rule your pace. Not like sometimes most of them need reorientation, need boundary setting, but you just have to be careful in like setting your boundaries, because someone can be strict to them and eventually they hold their answers to your questions. They might not give you the fact they end up frustrating you. So, talking about the pathology. So, because she was delusional. She was very delusional at some point. In as much as she was like seeing, no, she was very delusional. So at that point, she was really like I would say kind of like anxiety. She was like catatonic. So after a little while, when I started offering her something, she was a kind of relaxed. She was a little bit sober. So I would say her symptoms is in alignment with symptoms of bipolar disorders. Extremes of moods, from catatonic to from anxiety to or irritability to like depressions, like swings of moods. So my knowledge about bipolar made me to really like pick on that diagnosis at that moment. Also and like my ability to pause and have patience with my patient also reminds me the relevance of good patients, relevance of good clinician patient relationship, because that will form the basis of my treatment plan. That will form the basis of their visit or whatever I'm doing for them. So, talking about my strengths, one of my strengths is empathy and patience. I would say, like, in a real life, I'm a patient individual, so I bring this to my clinical setting, to my clinical rotation, or to my clinical experience, because being patient with patients will help. It helps a long way, because that will help you to like build rapport with them. That will help you to like, establish trust. Also, I'm very empathic, At all times, I try to place myself in the shoes of the patient. What if I was this patient? What if I was what if I was having these symptoms, So these are the things one of my strengths. So my therapeutic use of self involves the use of calm language, the use of being empathic, the use of body languages, being calm, being patient, being empathic. These are my therapeutic use of self. Also, I try to be non-judgmental. So, application for future nursing, psych nursing practitioner role. I reflect on this encounter because it will help me to. I will reflect the relevance of being patient, the relevance of being empathic, the relevance of being non-judgmental, because that will help me to establish rapport, that will help me to build relationship with my clients. So when I have a good relationship with them, it will lead to a smooth care of patients. They will understand you and you will understand them. Thank you.